All right, guys, I got my first request. That request was to go over Joe Biden's healthcare plan. Sounds fun, but let's do it on today's episode of My Political Mind. Let's hit that intro. Bam. I don't know if I'm gonna do that every episode, but the first two seems plenty enough. So I might cut that out next time. I'm gonna have to get like an actual. I'm gonna have to create an actual intro at some point, but for now, that'll do. All right. So I did some investigating, a little bit of research, some googlings, and I've decided to do one video, which is going to be like the beginning of this video. This is going to be one long video, but I'm going to cut it down. The beginning is where I just go over like all the basic stuff, and then the extended version of the video, I'm going to go into like everything, hard detail. I'm going to go to the Joe Biden website, look at the plan, break it down, and if you're into that kind of wonkiness, we can do it, and I'm gonna do it, and we'll do it. So, all right, so let's get into the plan. All right, here we go. Joe Biden's healthcare plan. Obviously, it is not Medicare for all. It won't be Medicare for all. Probably for a while. Whether you like that or not, doesn't really matter. I'm just stating a fact. Medicare for all is not part of Biden's plan. Obviously, I think everybody knew that. Biden wants to. So he's got like all these different initiatives or whatever. So he wants to lower Medicare age to 60. Many estimates predict around 23 million Americans will be eligible for Medicare with this action. And it seems to be a compromise of Warren's plan to lower the age to 50. If you remember, Bernie Sanders' plan was, it was like every year or 2 years you lower the age more and more until it went to 0 to infant. So it adds 23 million will be eligible because of this. I did not look up how many are eligible now for Medicare, but obviously you're lowering it by 5 years, so you're gonna add millions of people, which is a good thing. I mean, it's not as far as people want to go, but you can't say that it's not progress. You literally can't say that because it is progress. That's what that is. But anyway, next initiative of Joe Biden's plan is ending surprise billing. So if you don't know what surprise billing is, that is basically, think if you like had a heart attack, God forbid. But think if you had a heart attack and then you got picked up by an ambulance and taken to a hospital, and some rando doctor took care of you, fixed you up. You got good, you got nice, you got healthy, You went home, couple of weeks later, a month later, I don't know how long it takes. You get a medical bill. You get a bill, and it's just this like astronomical amount. And you go and you try and figure out why, and the reason why is because the doctor that took care of you was out of your network. Okay? They can do that. The Biden plan, he wants to make it illegal for healthcare providers to charge an out-of-network rate if the patient has no control over the doctor they see. So if the patient has no control over who they see, like in the case of you have a heart attack and have to be rushed to the hospital, what are they going to like? Oh, this guy's not in our network, so send him off. Send him somewhere else. No, they're going to take care of you because it's the right thing to do. But it's outrageous that you should get a surprise bill that could end up putting you in financial ruin. Could make you file for bankruptcy. But if it was under your insurance, it wouldn't be that way. But it's not under your insurance because the doctor is out of network, which is ridiculous. So that's a good plan. I mean, that's a good initiative. That's a good action to take. I don't see how anybody could disagree with that, honestly. And that is more progress. Let's see. Reforming prescription drugs, an effort to lower cost. He wants several steps. There's several steps to getting this done, according to Biden's plan. Biden's plan. I don't know why I always do that. Repeal the exception that allows drug companies to avoid negotiating with Medicare over. Negotiating with Medicare over drug prices. Sorry. So repeal the exception that allows drug companies to avoid negotiating with Medicare over drug prices. Good thing. Limit launch prices for drugs with no competition. I think you can do this. Let me speak in libertarian, because you might understand this. I think this is perfectly okay if government has had any, if the company, the drug company, got any kind of taxpayer research money to help develop the drug, like what most of them do, or at least several of them do, then I think that's okay. I think that's if. Now, I don't know if the government didn't help develop a drug, then I don't know if you can reasonably limit, unless it's like a life-saving drug. See, that's the thing. It's healthcare. Like, I just throw free market out the window. That's me. But that's where my moral compass is. I don't think anybody should go without healthcare. So, moving on. To also help lower the drug prices, he wants to limit price increases to follow inflation. Limit the price increases to follow inflation. Cut. Are we back on? Anyway. Limit price increases to follow inflation. I don't know what that means. I'm just going to be straight up. Maybe I'll have a better understanding of it once I go over the whole plan. But I'm not going to lie to you folks. I don't know what that means. Limit price increases to follow inflation. I assume that means, so you got drug prices going up this way. You've got inflation going up this way. But they want to make the cost of drug prices to fall below the increase in inflation. So you have inflation going this way, and they want to kind of more not have the drug follow inflation, but instead, lower than inflation. I think that's what that means. I don't know. We'll find out. Allow consumers to buy drugs from other countries. I think that's fair. End tax breaks given to drug companies for advertising. Yes, I think that's obvious. Improve supply of quality generic drugs. I'm going to get into how he plans on doing that if it's on the website. They just keep what? Who am I? Who am I? Sam Cedar? Am I Sam Cedar? Pause. Love you, Sam. I love you, Sam. Public option. This is the big one. Biden does not want to eliminate private insurance. He would rather have a public option that competes with private insurance and provides an option to laid-off workers or those with a limited employer-provided plan. Similar to Medicare, and covers primary care without copay. Public option would negotiate plans with hospitals to reduce overall costs for plan members. And we're still not certain on how this plan will be rolled out or how to sign up for it. That still needs to be worked out. But yeah, that's like the basics, the compressed version of Biden's plan. I will get into the cost aspect of it in the extended version of this video. But yeah, tell me what you guys think. Do you like the public option? Do you think the public option is a good idea? I think that public option will ultimately pretty much inherently will lead to some type of single payer healthcare system. Maybe not Medicare for all, but it will lead to some kind of single payer healthcare system, like universal, because it itself is kind of like a single payer healthcare system. But I think it'll be more universal where everybody has it, and I don't see why that shouldn't be the case. But let me know why you think that should be the case, or why you agree with me in the comment section below. Tell me what you think about Joe Biden's healthcare plan. Do you like it? Do you love it? Do you want to completely toss it out? Do you accept a little bit of progress over no progress for 4 years? What do you want? You tell me. Tell me what you want, and I will try to give you my fair opinion on, what I think about your terrible opinions. I'm kidding. Maybe. No, I'm really kidding. I love you guys. But yeah. Thanks for watching the short version. I love you guys. Peace out. Doesn't the Amazing Atheist do that? Like,